Hi, today I'd like to talk to you about another common cause for miscarriage and recurrent miscarriage, which is PCOS. PCOS is a common condition we see among young women these days, and it has very key distinct symptoms that we can discuss together. Now, the main cause of PCOS, according to our research, is that during the early developments of the ovary, there are some leftover gonad tissues, which means these tissues containing male sex organ tissues, which is specifically Leydig cells, which means these tissues that are supposed to be found in the testes, they are left over during the development of the early development of the ovaries. So whereas a normal, a healthy girl, during the early developments, there will be no remaining of these Leydig cells, but some women will experience this remainder of these Leydig cells, and the severity of your PCOS will mainly depend on the amount of these Leydig cells that are remained. If you have a high amount of Leydig cells that are left over in your ovaries, then you will see a much more severe level of symptoms, and it affects your pregnancy, miscarriage, recurrent miscarriage much more severely. So which is why we need to take PCOS as a serious factor for causing miscarriage. Some of the symptoms that we can observe with people who have PCOS is that, first of all, they have very high blood testosterone, almost as high as their male counterpart. So which is why we will see symptoms such as they have excessive body hair, and then the hair is also quite rough and thick. And then another symptoms we also will observe is that they will have acne in the face or the body, and then they will also have a much more rougher voice. These are all the physical symptoms that we can observe. Furthermore, they can also develop insulin resistance, or maybe diabetes as well, causing them to have excess fat accumulation, leading to obesity. Now, having obesity and excessive fat further complicates your pregnancy journey. It makes it much more difficult, and treatment needs to be much more holistic now. We not only need to deal with your PCOS, we also need to deal with your obesity as well. Only by dealing with both of these, we can only achieve a successful pregnancy. So here at Antai Hospital, our treatment is much more different than conventional treatment. Conventional treatment, if you have PCOS, or if you know anyone with PCOS, you know that they'll be consistently taking oral medication, oral estrogen or estradiol medication, or birth control pills, mainly in the form of pills and oral medication. Here in Antai Hospital, we conduct surgery, and our surgery is by using 3D laparoscopy to pinpoint these Leydig cells inside your ovaries. So we'll cut open your ovaries, find out all these Leydig cells using ultrasound, and then we will need to remove them surgically one by one, leaving no Leydig cells behind. And afterwards, we will also apply a bioadhesion barrier to help recovery for this patient. Upon 3 to 6 months, this patient, after receiving treatment with Antai Hospital, she will begin to menstruate regularly. She will see her symptoms subside, and then she can also conceive naturally, have successful pregnancy. These are all several testimonies and several patients that have come to treatment with us, and this is what they have achieved. So if you know somebody who has PCOS and seeking to get pregnant, or if they have experienced repeated pregnancy losses, repeated miscarriages, share them this video, let them know that there is treatment out there. So if you want to find out more information about PCOS, its several symptoms, how it affects her pregnancy and miscarriages, please visit our website. Leave me some comments down below as well.